A free symposium this month highlights resources for patients with movement disorders, things like Parkinson's disease.
Yep, Dr. Matthew Burton and Dr. Heather Pinkard-Dover is with us now from Marshall Health. Both will be speaking at that symposium, and they're here to tell us about some of the topics and some of the things that they're going to be discussing. Thank you both for joining us.
Great to see you all.
Yeah. So this is the first time you're doing this, right?
Yes, ma'am.
What made you want to start a symposium like this here in the area?
I think the big thing's been is just that there's a lot of difficult information to come by for patients, and I see this a lot in my clinic on a day-to-day. They have a lot of additional questions, trying to get through, find good, reasonable answers instead of just scouring the internet. So we felt like getting some of the state's experts together to give good information to patients and caregivers has really been the core focus of the symposium.
That is a great idea. Well, what are some common movement disorders?
So essential tremor is actually the most common one that you'll see that can start as early as the teenage years, but Parkinson's is the one that everybody talks about. But there's also things like MS, ALS, dystonia, so some other movement disorders that are also included.
So it's more than just Parkinson's that we'll be hearing about. Okay.
So how will the symposium work? Is this going to be a multi-day event where you're focusing on different topics throughout, or is it a one day and you focus on different things throughout the hour? How's it going to work?
So Friday is geared more towards patient and caregivers, talking about all the different movement disorders, and then Saturday is geared more towards healthcare professionals, so physicians, nurse practitioners, APPs, physical therapists, occupational speech therapy, all of the healthcare workers who interact daily with these patients, trying to improve their education as well so they can help us identify these people and get them to the right resources.
Okay, that's wonderful. So now that people are hearing about this, how do they register? How can they get the opportunity to attend?
So this is being put on through the West Virginia Movement Disorder Alliance with conjunction with the Charleston Parkinson's Support Group and the Mid-Ohio Valley Parkinson's Support Group. So they can go to the wvmda.org website, and from there is a registration link to register. The first 100 people that register get a free copy of the Parkinson's Plan, which is a new book by Dr. Michael Oken, who will also be there virtually talking to us as well.
And where is this going to be taking place?
At Grand Central Church of Christ in Vienna, West Virginia.
Okay. So a centralized location for kind of splitting the difference there for people in southern West Virginia, northern West Virginia, which is nice. So tell us a little bit more about what you all do here locally to help patients. I mean, there have been so many advances within this industry over the years, and some additional things that you've been able to do to offer people back some of that life that maybe they knew before their diagnosis. So what are some of the things that you're working on here locally with patients?
So myself as a movement disorder neurologist, I work mainly in the clinic, focus on medication adjustments or simple things like Botox for things like dystonia, which is severe muscle spasms for patients. And then I do the programming side of deep brain stimulator, but Dr. Pinkard-Dover is our actual surgeon that does the surgery itself.
Yeah, tell us a little bit about that.
So deep brain stimulation is where we place wires into deep structures of the brain to provide stimulation and kind of break up that abnormal signaling that leads to the tremors and the stiffness and the slowness that we see with Parkinson's or essential tremor or dystonia. And then I also offer baclofen pumps for patients with like MS and spasticity for that standpoint.
How encouraged are you all about some of these new developments and treatments and things that you can offer people?
Yeah, I think it's been really helpful in my clinic for, as things progress for patients. We now have new things like medicines that can be in a pump formulation, so they don't have to consistently take pills throughout the day and stuff like that. And it's been really helpful for a lot of my patients that take a lot of medicine almost around the clock to be able to have something like a pump on that helps take care of their daily activities and helps give them some of that freedom back.
Oh, that's great. And if people want to find out more, but maybe they can't make it to this particular symposium, what's a good way to find out what you all do?
So they can always go to the Marshall Health website. There is information there about Dr. Burton and my clinics, so you can find our numbers there and give us a call, or call the Marshall Neuroscience number at the 304-691-1787.
I bet you're going to get a great turnout with this because, that type of a diagnosis, it can be very overwhelming, and like you said, you're immediately trying to research every little place that you can, and that becomes a lot all at once. So it's nice that you all are offering this all under one roof for patients and for their caregivers. So thank you so much. Best of luck with this event. Hope it continues for many more years.
Thank you.
And we'll be right back.